Revolution CT is a breakthrough that puts in your hands uncompromised technology, coverage, spatial resolution, temporal resolution, and dose performance, all in one CT. In cardiac imaging, you can use Revolution CT to acquire one-beat, motion-free coronary images at any heart rate, even for your most challenging patients. You can prepare your patients quickly with the help of the ECG module integrated into the table and the ECG waveform shown right on the gantry display. After the SCOUT acquisition, you can perform a breath hold test that is recorded by the system to analyze the average heart rate and variability. Using the SCOUT and the data from this test, Revolution CT's auto-gating technology helps you get the right settings for kilovolts, milliamps, and acquisition phase to help meet your image quality goals while lowering dose. The automatic bolus tracking system helps you synchronize the acquisition with the injection. Once the predefined threshold is reached, the acquisition is triggered and the entire examination is performed in only one beat. The Clarity operator environment supports you with instantaneous access to images as they reconstruct, and by automatically pushing them to viewing stations for your review. You can also post-process the images directly on the Clarity operator environment without interrupting your patient workflow, thanks to the multiple session capabilities. For complex cases, such as planning for TAVI procedures, Revolution CT's combination of speed, coverage, and resolution help you image the entire aorta in only one contrast injection, typically in less than 7 seconds. One of the keys is that Revolution CT allows you to quickly switch between multi-volume gated axial and fast non-gated helical scans seamlessly. The result? You can generate excellent image quality for both the coronary arteries and the entire aorta at low dose without having to ask the patient to hold their breath for an extended time. The user interface of Revolution CT is very intuitive, and you quickly get used to it. After only one day of using the system, we were already scanning 40 patients in a 9-hour day. Patient preparation is easier thanks to the large bore and the integrated ECG. And the low noise level of the system improves the communication with the patient during the exam. Besides, less effort is required for the patient thanks to the speed of the system. For the cardiac exams, the Revolution CT enables the acquisition of the whole heart volume in only one beat. The exam is extremely fast, and the motion of the heart is frozen not only for patients with stable heart rate, but also for patients with high heart rate or arrhythmia. This has significantly improved the success rate of cardiac CT exams with an excellent visualization of the coronary arteries. Revolution CT also opens the door to new CT applications such as 4D dynamic imaging of coronary arteries and myocardial perfusion imaging. The first results are really promising, combining anatomical and functional information in a single exam. Improved robustness, better image quality, and lower dose are the main benefits of this revolutionary system. Cardiac CT becomes more and more the first-line exam in the evaluation of ischemic cardiopathy.